Good evening, friends. Once again, this is Dr. Chetna Jain back with another health related topic. Today, we are going to talk on intimacy without contraception. Now, this is a very, very important topic. Youngsters, they indulge into sexual intercourse at a very young age, and then they're probably not aware of what kind of protection they need to prevent a pregnancy. Then it is also valid for married couples who are into a relationship, for people into relationship, and also for married couple who would not want to have a child soon. Then there is another group who would not mind if a pregnancy occurs, but they're not looking actually forward to a pregnancy. So we are going to address all this. Now, what is contraception? Contraception is prevention of a pregnancy. Prevention of an unwanted pregnancy is contraception. Now, contraception is a very relevant point because the younger you are, the greater are the chances of conceiving. Now, a lot of you depend on the rhythm method. That means you believe that ovulatory days are unsafe and the other days are safe. But mind it, even if somebody has sex in the first half of first 7 8 days of the cycle or last 7 days, still they can get pregnant because sometimes the ovulation could be very early or very late. So you can't really depend on these things. Now, what all you can do to prevent a pregnancy? The best thing would be to use a condom because that not only prevents a pregnancy but also prevents other sexually transmitted infections. Now, if you are into a monogamous relationship, that means you're one to one, you must see that, if you can manage without having intercourse, and the rest of the sexual activity is probably fine. But if you think you want to indulge into and you think that your relationship is monogamous, the chances of getting STI is pretty less. So here we go. Uh, First thing, there are various kind of condoms which are available in the market. So latex condoms are the most common ones. Some women are allergic to it. Then you have ultra thin ones, or you have polyurethane ones, which are used by women who are allergic. Then there are female condoms to be worn by females. Now, a lot of you juggle with the problem while you're together, and what happens by the time you put it on, the mood goes off. So, the method is the female condom can be inserted at the beginning of the activity only, so that you don't have to use it or fiddle with it in the middle of the process, while the male condom has to be worn at the correct time. Now, tablets can also be used. Now, these tablets need to be inserted 15 to 20 minutes before, and they remain active for about 1 to 1.5 hours. So that's the window you can use it. Condoms alone have a very high failure rate of 10%, and when used along with a spermicide, then it works well. So the other method of contraception could be oral contraceptive pills. Now, there's a lot of myth about oral contraceptive pills that can lead to future infertility. Mind it, this is not the case. Contraceptive pills will never interfere with any future fertility issues. Yes, the fertility decreases with age. So before you decide on when to have a baby, consult your gynecologist to know what is the optimal time for you. It's not that all women at 25 have similar fertility and all women at 35 have no fertility. This is not the case. Some women at 40 are very fertile, and on the other hand, some women at 25 are also very low in their fertility. That means their ovarian reserve is pretty less. So, oh, by taking contraceptives, so how does it work? It prevents the formation of egg in the from the ovaries till the time you take it. That means it is conserving the number of eggs in the ovaries, so it cannot in any way decline the future fertility reserve. As the increases, the body kills its own eggs and the numbers go down so much so that at menopause there are hardly any viable eggs left. So once you make up your fertility plan, if you have certain factors which are fitting into your physical characteristics, like you are not obese, not diabetic, not hypertensive, you have no migraine, no blood pressure, no other illnesses, no family or personal history of cancers, then probably you can cholesterol, then you can probably very safely take contraceptive pills. There are various varieties available depending on the body weight. A thin person can actually use a low estrogen content contraceptive pills, while a fat person would probably need a little higher dose to prevent the breakthrough bleeding. That means spotting in while you take the medication. So contraceptive pills are typically started on day 1 or 3 or 5 of the cycle, depending on the type of the pill, and they are taken on a regular basis. Generally, they are taken 21 out of 28 days. This, when you take it regularly, there is adequate protection, and you don't need an added protection. But the disadvantage of contraceptive pills, a lot of women they stop taking it without informing their partner, and the partner it doesn't know that if the pills have been stopped, the woman can actually get pregnant. So the onus of contraception lies not only on the woman but on the man also. But in the clinic, we see that majority of the time when it comes to contraception, generally woman comes alone. Very rarely we see them with their man. The boyfriend never comes. It's only the female who comes in and discusses this. So the onus is on both, and it is important that it is a informed decision taken by both jointly, and then you stick to the plan and do not change. Now, the advantage of pills is it gives a predictable regular cycle, reduces menstrual flow for women who have excessive bleeding, and at the same time, you do not need to use any interference. So the sensitivity of the sex is very high. The disadvantage is you need to remember to pill every day, and it can alter the cholesterol profile, and to some extent, it marginally can increase the chances of breast cancer. However, the risk returns to baseline after stopping the pill for about 5 years. So the risk is not very high, and one should not be too worried about it. Now, a lot of women are depending on the emergency pill, that is I pill or unwanted 72. This is a very bad thing to do because it alters your body profile in a way that you suddenly you introduce a very large dose of progesterone. So much so that even married women with grown up children, they end up having unwanted 72 or I pill kind of preparation once or twice in a year or more. This is not the right thing to do because these pills are to be taken only if it happened in a situation where it was completely uncontrolled. Otherwise, it is completely it's not a good idea. So, what is recommended if it was something which was out of control and it happened like in rape or something? Then in that scenario, I feel is probably recommended. But in rest of the scenarios, it is not advisable to use IPL regularly. So we were talking now men would want intimacy without any interruption. So ultra thin condoms should be able to do their job. IPL is not a good idea. Oral contraceptive pills in a monogamous relationship is fine. If you are not using any protection, if you fail to use condom, then the pregnancy is real, and also and if you're using contraceptives, then again the same failure is 1 in 400. And in this scenario, since you must screen yourself and your partner annually for any STI, that is sexually transmitted infection, to know there is no infection, because any infection because of the current exposure or because of the past exposure can actually propagate. HPV virus, if present in the cervix, can lead to cervical cancer. So it is important to screen for HPV virus when you are sexually active. The screening can be started as young as 21 and can complete at 64. Beyond 64, we don't need any screening for cervical cancer. So uh, uh, a protected sex with in a monogamous relationship will prevent not only STDs, HPV, cervical cancer, and a lot of other diseases. However, so, if you had multiple partners in the past and you want to protect your partner, still it is best to use a barrier kind of protection. Now, if at all you don't want to use anything, then one has to be very careful because even pre-ejaculate can have some sperms and the woman can conceive. So the vaginal condom is a good idea, or at least use the spermicidal tablet and probably use the withdrawal technique just before ejaculation so that the chances of pregnancy is not there in your partner. There are other methods which are long-standing. One is multi-load and then other is Mirena. So these are intrauterine devices. Multi-load contains copper T and Mirena contains levonorgestrel hormone. They are fitted into the uterus. They have their own set of benefits. This will also not interfere with the feelings of intercourse because you're not using any uh, plastic or polyurethane or latex in between the two. But certainly the chances of pregnancy is about 0.5%, which is like 1 in 200. So when you're using them, and Nirina has a very low failure rate of about 1 in 1,000. The other method of contraception, if your family is complete, you can go in for the permanent method. Now, this could be a female contraception or a male contraception. That means a female sterilization or a male sterilization. So once you do sterilization, the chances of conceiving is very low, 1 in 200, and a male failure is almost nil, is 1 in 1,000. But in spite of having a permanent method, if you think that you have any feeling of being pregnant, please ensure that you do a pregnancy test and identify if there is any unwanted pregnancy. So there are very many methods to prevent it. To improve the sensation, there are other things which can be used, like you have rib condoms, you have stud condoms, you have flavored condoms. The other thing I want to point out here is non-genital sex leads to a lot of infections, and it should not be done unprotected. If at all it is done, it has to be protected because saliva contains a lot of bacteria and fungus. Dental dams can also be used for the same purpose. It may look unhygienic to a few, and some people cannot stay without. So it is a very, very individual practice. Though in the olden times this was not existing, but with the introduction of the social media and other things, people have become aware and they want to experiment a lot in this scenario. Probably we will have to talk about it. So dental dams, female condoms or male condoms will be used together, or one, but male and female condom both cannot be used together. Either you use male or female or dental dams. If you use all together, then the chance of slippage is very high, and again, the accidents might happen. So, to conclude, if we talk, so we've talked about the very thin condoms, uh, uh, non-latex polyurethane or ultra thin. Then we talked about spermicidal tablets and contraceptive pills. Then there are injections also available. These injections are given once in 3 months. These injections can lead to prolonged periods of no period or a prolonged period wherein the blood bleeding continues. So all those could become a nuisance in your life. So injectable contraceptive is used only by probably the rural population where the access to contraception is very less. The advantage is the failure rate is pretty low and you do not need any barrier between your information. So that works well. But the irregularity in cycle bothers women and they need to keep doing the pregnancy test to be sure that, you know. And the second disadvantage of these injections is there's a delay in fertility. Sometimes the delay in fertility could be to the tune of 1 year. And 1 year could be a very long time if you're planning a baby. So if you're spacing between two children or if you have not had even one child and you want to delay your child, but probably injectable contraceptives are not a very good idea. So in all, the best advice would be for a young couple who is healthy, oral contraceptive pills, once they are settled in their marital life, 3, 4, 6 months down the line, they move on to barrier, a thin barrier, along with spermicidal pills or a barrier with withdrawal technique. So this can help. Do not depend alone on spermicidals because they alone have a very high failure. And a lot of people say to prevent pregnancy abstinence, but abstinence is not the right thing because everybody will have their own set of pattern and they need to stick to it. And being intimate with your partner is also part of growing up together and being affectionate and loving each other. So that's how God has made it, and there's nothing wrong there. But it is important to do it at the right time. So the suggestion would be the best thing to get married and do it, but if you do it before, use it with protection. You should not conceive. It is not a good idea to conceive and terminate. We see regular faulters wherein they have terminated 2, 3, 4 pregnancies before they actually get married. And once they get married, it becomes very difficult sometimes to conceive, and then there's a lot of regret because repeated pregnancies sometimes can lead to damage to the uterine lining and future reproduction. If there is introduction of infection, if it is not done at a proper center, or if it is not done through medicine, introduction infection can lead to damage to the fallopian tubes of the uterine lining, leading to future risk of pregnancy. So it is not conceiving, I mean. So it is important to uh, defer the actual sex, and you can have the rest of the sexual activity but defer the intercourse till the time you're very sure that you want to spend your life with the same partner. A lot of people want variety, want to change partners. Probably not the best thing to do because it's something like the more you will try, the probably you want to try more and more, and there's no end to it. And towards the end, if you get STI, it is a challenge. But yes, for some reason, if you ended up having multiple partners, then annual STI screening for you and your partner is very essential. Do not hide any such history from yourself to your, and your partner, and take adequate treatment so that the disease is not propagated and it is not spread in the community. So various STIs that one needs to test is HIV, hepatitis B, hepatitis C, VDRL, which is syphilis, and HPV infections. So these are common STIs which are transmitted. There are others also like chancroid and gonorrhea. So in case of herpes, in case of symptoms, the doctors can identify, examine, and treat. Majority of the STIs in females are treated by the gynecologist, and male STIs are treated either by urologist or andrologist or the skin and venereal disease specialist. So, with this, I would like to conclude my today's discussion. I hope you picked up some important points. I'm here now to take your questions, even if the questions are not related to contraception. If these are some other questions, it's all right. You may talk to me now. Thank you. I guess there are no questions. I think there's a question. What type of contraception is barrier method of birth control? So condoms are called the barrier methods. It could be female condom or a male condom. The female condom is worn by the female and the male condom is worn by the male. Male condoms are very popular. Female condoms are a little difficult to identify, but if you search it, you will find it. If there is no if there is no intimacy without contraception barrier, then what are the if we do intimacy without condom, then what are the problems which we can face? So, so one is STIs, second is unwanted pregnancy. So these are the two things, and cervical cancer is the last one. So all women should get vaccinated against cervical cancer. So in case they get HPV, their chance of getting cervical cancer becomes almost nil. As of now, the current studies say that if you take 3 doses, the the immunity against cervical cancer lasts for lifetime. So it gives almost 97 to 99% protection against the cervical cancer. So STI, cervical cancer, and unwanted pregnancy are the side effects. The STIs, I told you, if I need to repeat, HIV, hepatitis B, hepatitis C, herpes, VDRL, that is syphilis, chancroid, and gonorrhea, chlamydia. These are the diseases that one can get and transmit. It can lead to, it can affect future fertility. It can compromise the future fertility. What are the types of contraception? Okay. So there are various kinds of contraception. One is the barrier, which is a male or female condom. Then we have oral contraceptive pills, which are of two kinds. One is progesterone-only pills, which are useful for lactating women. Then we have combined pills. And combined pills also have three types: mini dose. Then we have pills starting from day one of period. Then we have pills starting from day three of period. Then we have pills starting from day five of period. And then we have tricycling pills, where the pills are continuously taking for three packets and then stop. So these are the pills. Then you have unwanted 72, which should not be taken. Then you have intrauterine contraceptive devices like multi-load and copper T. Then you have injectables like uh, Depo-Provera. And finally, you have, what did I miss? Did I miss anything? No. The North plants and other things are not available in India, so we'll not talk in English. These are. not useful. Then permanent method is there for those who have completed their family and they're very sure they would not never want another child in the future. So this is all. Thank you. So you can subscribe to my page and I'll be back on next Wednesday with another topic. If you would like to hear something special, you may WhatsApp me on my personal number. That's 9910907222. That's 9910907222. You can WhatsApp and I can take your topic into consideration. Thank you very much.